Preeclampsia is a dangerous condition that some people get when they are pregnant. It usually happens during the second half of pregnancy, after 20 weeks. It can also happen during labor or soon after the baby is born. People with preeclampsia have high blood pressure. They might also have too much protein in their urine, or problems with organs like the liver, kidneys, brain, eyes, or placenta. Plus, the baby might not grow well and be smaller than normal. Most people with preeclampsia do not feel any different than usual. Preeclampsia usually does not cause symptoms unless it is severe. Signs and symptoms of severe preeclampsia include bad headache, changes in vision, like blurry vision, flashes of light, or spots, belly pain, especially in the upper belly. If you have any of these symptoms, tell your doctor or nurse. You might not have preeclampsia because these symptoms can also happen in normal pregnancies. But it's important that your doctor knows about them. Preeclampsia can slow the growth of the baby, decrease the amount of amniotic fluid around the baby. This is the liquid that surrounds and protects the baby in the uterus. To test for preeclampsia, your doctor or nurse will take your blood pressure, check your urine for protein during pregnancy. They might also do blood tests to make sure that your organs are working as they should. When your doctor or nurse tells you your blood pressure, they will say two numbers. For instance, your doctor or nurse might say that your blood pressure is 140/90. To be diagnosed with preeclampsia, your top number must be 140 or higher, or your bottom number must be 90 or higher. Plus, you must have too much protein in your urine or certain problems with one or more of your organs. It is possible to have high blood pressure above 140/90 during pregnancy without having high protein in the urine or other problems. That is not preeclampsia. Still, if you develop high blood pressure, your doctor will watch you closely. You could develop preeclampsia or other problems related to high blood pressure.
Imagine a ticking clock. Preeclampsia can develop at any time during pregnancy, but it's often diagnosed after the 20th week. The only definitive cure for preeclampsia is giving birth. However, the timing of this depends largely on the severity of the condition and how far along the pregnancy is. The less severe cases of preeclampsia often involve waiting, especially if the pregnancy is less than 34 weeks along. For those between 34 and 37 weeks, the choice of action is a discussion between you and your doctor. If you are more than 37 weeks pregnant, giving birth is usually the suggested course of action. While waiting might be an option, it's not a passive one. Regular checkups are necessary to monitor any potential problems. In some instances, hospitalization might be required until it's time to give birth. When the moment arrives to welcome your baby, inducing labor is a common procedure. A vaginal birth is often achievable, but in certain situations, a cesarean birth might be necessary. For severe cases of preeclampsia, immediate birth is usually the best course of action, coupled with medication to lower high blood pressure. This is to prevent severe complications such as stroke. Seizures, although rare, can occur in people with preeclampsia. Therefore, your healthcare provider might administer medication during labor to prevent this. You may wonder if there's anything you can do to prevent preeclampsia. Unfortunately, there's no surefire prevention method. The most crucial step you can take is to attend all your prenatal appointments. This allows healthcare professionals to detect any signs of preeclampsia as early as possible. Those at high risk of preeclampsia, such as those with a history of the condition or those pregnant with twins, might be advised to take low-dose aspirin after the 12th week of pregnancy. However, remember to never take any medication without your healthcare provider's guidance. Having had preeclampsia increases the risk of high blood pressure and heart disease later in life. It's essential to inform your primary care provider about your history with preeclampsia, so they can guide you on lifestyle modifications to lower these risks. Lastly, always stay vigilant for symptoms of severe preeclampsia, such as bad headaches, changes in vision, belly pain, or new shortness of breath. If you notice any of these symptoms or anything unusual, don't hesitate to contact your healthcare provider immediately. In essence, preeclampsia is a serious condition that requires careful monitoring and timely intervention. The key to navigating it lies in early detection, regular prenatal checkups, and open communication with your healthcare provider. Remember, it's not just about the pregnancy, it's about your long-term health too.